Hello everyone, my name is Kavera Elejunik with a metric number of 78514. So a family is a sense of belonging of a group made of two or more people who recognize themselves as related by blood, marriage or adoption. As a result, it is a group of people who are directly related by kinship and whose adult members are concerned for the welfare of their children. Family is also the institution with the most concise and interaction between the private and social spheres, therefore leading it to be regarded as the fundamental social institution. The family institution is a basic unit in society, yet the multifaceted functions it performs make it a much-needed institution in the society. In Malaysia, families could be from one of three major ethnic groups such as Malay, Chinese, or Indian. Elders are highly respected and extended families are regularly coexisted. Meanwhile, unmarried adults often live with their parents until they marry, while young married couples like to live close to their parents. On top of that, when the children make decisions, parents prefer to be involved in the discussion until solution is achieved. Therefore, Malaysian households are said to be promoting cooperation and loyalty towards their family.
Hello, my name is Nurul Shafika Akasha binti Sahad, number metric 78473. I will be presenting about the social class of the family and their accessibility to healthcare service in Malaysia. So, let's go through the first one. What are social class? Social class is a group of people that lives in a society that have the same socio-economic status. So, the upper class is group that have the highest status in society. And then middle class is group of people that majority of the individual in this class works as a professional, such as a doctor and nurse. And the last one is lower class, the group of people that is known as underclass and people with lower income. So does Malaysia have social class? Of course, the social class in Malaysia is divided by three, which is T20, M40 and B40. T20 as the upper class is the group that represent the top 20% of Malaysia. Their monthly household gross income exceed RM 10,970 ringgit. And then M40, which is the middle income group, represent 40% of Malaysia. Their monthly household gross income is between RM 4,851 ringgit until 10,970 ringgit. And the last one is B40 that represent the lower income group. They are the 40% of Malaysians that have monthly household gross income that is in the range of 1 ringgit to 4,850 ringgit. This social class difference have effect to the healthcare service in Malaysia. The first one is vaccine. The T20 or some B40 rather get vaccine shot by buying it in the hospital despite the high cost. And the next one is homeless people. Homeless people are associated with other diseases because of their living style, such as leptospirosis. And then the third one is insurance. Insurance is very important, such as health insurance. The T20 people can easily buy it despite the high cost. And the next one is mental health. Not everyone who receive proper education are aware about mental health. Thus, the group of people that does not receive proper education may perceive mental health as taboo. The last slide talk about first maternity. T20 prefer to deliver their baby at private hospital because of the highly skill of specialists, the comfort and the optimum care. Whereas the B40 and M40 prefer to deliver their baby at government hospital or at house, where this may lead to the death of the mother because of the less specialists. And then the second one is behavioral change. Behavioral change talks about the T20 can eat all the food following the food pyramid, where this is healthy, whereas the M40 and the B40 might as well continue to eat canned food and make instant noodle for a month to save up their money, where this can cause another health complication. And then the last one is period poverty. Period poverty is majority experienced by the underclass in Malaysia, where such as homeless people because they don't have income, and thus this makes them inaccessible to sanitary product, which this can lead to another health complication such as urinary tract infection.
Hi, my name is Ashley Masanandi Mang with matrix number 77852. Next, family that works for government get more benefit in terms of healthcare services. A person who works in the government sector usually get more benefit than someone who works in the private sector. The medical benefit that can be claimed by federal public pensioners are supply of medical drugs, medical tool or services, kidney treatment, expert services at any private hospital, emergency treatment at any private hospital, sterility treatment, and treatment at National Heart Institution. How does this influence healthcare in Malaysia? As we know, not all people could afford the medical services, especially medical insurance. By having a family member who works in the government sector, it can help them to get treatment without worrying about the fees that will be charged to them. The more people come to get treatment, the more experiences and opportunity for the medical staff to sharpen their skills. Thus, this will increase the quality of our country's healthcare system and services.
Greetings, my name is Muhammad Mirzan Aiman, bearing the metric number 78259 from Group 5. Continuing with the presentation on how family affects healthcare, today I'll be talking about how the family's geography and demography affects the healthcare that they're receiving. Let's start with geography. Since Malaysia is quite a young and developing country, nonetheless, it can't be denied the fact that there still exist pockets of society or family that lives in remote clandestine area which modern healthcare services can't be accessed easily compared to urban areas. And due to this constraint, they have to rely on traditional medicine or even obsolete religious ritual to cure them from the ailment or the disease that they're having. And relying on unsafe rituals and traditional medicine, it does poses a risk that the quality of healthcare that they're receiving, which can threaten their life. But sometimes this is not the case. Sometimes these families and societies do have access to modern and safe healthcare services. It's just that they opt not to believe in it or straightforward distrust towards it. And due to this distrust and Luddite way of life and thinking, they resort to practice all traditional ritual that they believe can cure them from the disease or ailments that they're having. But this poses a greater risk if the disease that they're having is proven to be infectious and can threaten and poses as a health risk towards their society and the greater society of Malaysia. And due to this, it is evidently proven that family does affect healthcare.
My name is Karastika Antonia binti Steven with metric number 78515. Next, social institution of family also plays a huge role in providing knowledge and first-hand experience regarding healthcare either within the nuclear family or the extended family. Increase in roles of family associated to healthcare are able to strengthen the overall health system. One reason behind this is the exposure concerning health to the family members habitually and routinely, which may shape the way of thinking and their point of views. Consequently, social institution of family is capable of making health actions and choices to have authority over their health as well as to avail oneself of individual rights as agents and not victims. Family also influence healthcare through discovery in researches. For example, the discovery of the rarest blood type in India due to genetic factors inherited by the offspring. In a way, family condition also affect the way an individual leads his or her life, such as for diabetic patients who needs to avoid excessive intake of glucose in their daily life. So in Malaysia, family does influence healthcare as a social institution. Since Malaysia is a multicultural nation with various of elements that needs to be taken into consideration when making healthcare decisions. From my point of view, Malaysians are really dependent on their family members and usually have tendencies to have strong family involvement in decision making, especially in their healthcare decisions. As being stated earlier, family is greatly associated with healthcare. With respect to that, family functions to care for their members by providing them with health insurance or services needed.
To summarize, a family serves many purposes for society in an absolute world. The collaboration between the family institution and professional at all levels of healthcare are essentials to care for their children, implementation, as well as evaluation towards the needs of the patient so that the healthcare system would implement extensive policies and initiatives that provide emotional and monetary support to families in order to meet their needs. Other than that, the desire to create a culture and environment in which patients, families, and healthcare professionals work together, valuing the person and working to develop mutual understanding and respect is referred to as family-centered care. Thank you.